Okay. Such a weird new setup. I think we are live now in this new setting. Yep. Okay. Here we go. So I am going to just jump right in. If someone is on though, can you give me the thumbs up that you can hear me okay and that you can see me okay? I don't know about this. This doesn't let me see the, how do I go back? Sorry guys, technology. I'm using this new, the comments will be on that side. The new interface for Facebook Live. So hello everyone, welcome. I hope that Easter Sunday, you and your family got a chance to get out and celebrate. It is so unique that we have these circumstances that we've had, and this is the first time that I've ever had to been indoors on Easter and not been surrounded with my family. And so I hope that you guys did the best that you could. We are still here. We are healthy. I'm grateful that all of you are okay. As far as I know, nobody that I know has been drastically affected by COVID-19 to the point where they're losing a loved one, although people are losing their lives drastically to this. So let's all be grateful that we are here and that we have been able to celebrate and eat and be with our family members. So welcome to Shelton Slay Monday. Woo! I did the little hyphen in between Monday because it made me think of Jamaica when they're like Mon, like how they call everyone Mon. So welcome to Shelton Slay Mon. So corny, I know. So today I want to talk a little bit about the early voting ballot, guys. So here we go. I'm trying to cover the address, but I requested okay. So in order to get an early voting ballot, you need to complete your application to vote early. And so I got my application from the Nebraska Democratic Party. So mine was white. But hopefully all of you guys, it's a green, trying to cover the address, not like you guys can't look me up. This is the portion that needs to be returned. And it has the address there anyway that I'm showing. And so you want to make sure, so I already did this. I did this with the white ballot. And so I called the Douglas County Election Commission to ask them if I needed to do this as well, because I still have not yet received my early voting ballot. And I don't know why, but other than the fact that maybe they are behind, they told me that it was processed today so that I should get it in about a week. So I'm still waiting for my ballot. But hopefully you guys all have done this where you complete it and send it back in the mail. Now, if you don't want to leave your house, you can take a picture of it and email it to them, which is really awesome for all of us who are trying to be safe indoors. So please be sure to do that. This is a safe way so that on April 12th, you do not have to leave your house and be exposed to anyone, especially if you have an immune disease or if you are to the targeted population, which is most at risk. So please, please, please be safe. Now, let's talk about COVID-19. So today I'm going to be a little bit more laxed and not as structured because I'd like to have more feedback from you guys. I am very disappointed. I'm very disappointed because I have been reaching out time and time again to just different individuals, different communities. And what I noticed was that every facility where anyone is, where it's a group of people. So think of group homes. Not just with people who are, I don't know, elderly in nursing homes. We also have foster care programs that have group homes. We have shelters. We have incarcerated individuals in the prison system and correctional facility that are not getting even like toothpaste. They are not following the 6 feet rule. So I am disappointed our veterans are in this population. I'm very disappointed that I keep seeing the amount of deaths that are happening in these communities. There is no level of transparency. We don't know what's happening, and this is happening all across the United States. So I am very, very frustrated with this issue that we are seeing right now. So I would tell you all, if you are as frustrated as me, please reach out to the individuals. I've sent emails to just people that whoever the CEO is for that company. I've been asking them, like, what can I do? Is there something that I can do? Can I send a message to anyone? I really feel like we need an effective plan. And this goes back to the plan that I spoke about with COVID-19. We need an agency. We need a federal agency, you guys, that is going to manage this. Nobody has a protocol for what we do in these situations. I've not seen one. I know that the CDC has recommendations, but when we have a group of individuals, especially individuals that might be at risk, when I worked at Children's Respite Care Center, which is CRCC now, but we had many individuals that were going to be living in community homes, which Community Alliance manages, like the ACT program, for instance. And so how can we effectively help individuals if we have no plan on how we're going to keep them safe? We should have no problem seeing what individuals are doing in group settings to keep everybody safe. So I'm very frustrated with that. So please reach out to those companies and ask them how you can support, because I'm quite sure that they are asking for some leadership and some guidance as well. And maybe we need to work together in trying to push the needle forward. So on my website, I listed my COVID-19 recommendations, and that includes us having an agency to manage items like this, as well as coming up with an agency to manage the crisis part, and then a pandemic team, bringing that team back to give us recommendations. And so here's the thing. I've been doing a lot of research on this topic, and I don't know if you guys have had the chance to see Governor Cuomo this morning and what he said with his beautiful, beautiful timeline. We are actually basically waiting for a vaccine for COVID-19. So until we have a vaccine, we will never truly be able to breathe and say that, yes, we are safe. And we will slowly, if we enter back into our community, it will probably be with masks, right? And PPE, and making sure that we are protecting ourselves. But please just know, give yourself patience, give yourself grace, give grace to all those around you, because this is going to be, we're going to still be adjusting. And I don't think that we all will be sure and confident that we've got this crisis managed until there is a vaccine that has been tested, that we know will not affect pregnant women, that we know that is safe for kids, right? There are steps that we have to go through for this. So I said I wanted to do some engagement. I've been talking for a while, so let me jump in and see. Hi, Ariel. Hi, Craig. Yay, Craig sent in his ballot request last week. And what questions do you guys have for me? I have a few questions that people have been asking that I'm gonna share with everyone. Please, please be safe. So while I'm waiting for any questions to pop in, Craig says Nebraska has 817 cases and 17 deaths. Oh my gosh. Oh my gosh, guys. And just think if we tested everyone. So, deep sigh. Some of the questions that I have been getting lately have been, Alicia, this is a really big race. It's, I think, the most difficult race, this U.S. Senate race, because there are 7 Democrats to choose from. There is one who is a libertarian. And so who do we pick for? And why should I pick you? And I would love to answer that question. So I am running for United States Senate because I believe that I am the best candidate to help us move this needle forward. This is an America I no longer recognize. I think the COVID-19 pandemic has shown how much work is needed in making sure that everyone has access to healthcare and making sure that our economy can stand on its own, right? To make sure that people are able to pay their bills if anything like this should happen again. And so what I've recommended on the website is a plan for $2,000 a month until we are out of this crisis. And that is not unrealistic. There are many countries that are doing this already. But in order for us to move the needle forward, and in order to represent Nebraska with all of the experience that I have as a mental health therapist, I have worked in hospitals across our state. I am not someone who's limited to Omaha. I understand that we need to have more hospitals and more access in the very rural areas. I'm very frustrated with what is happening in Kearney and in Grand Island and in these areas where we have plants that are not protecting their workers. And now all of a sudden we are having increases in cases. And so some of these beef plants are shutting down, guys. Like, this is a really, we are not doing a great job of protecting employees right now. And so I am a great researcher. I am someone who has been trained on Senate proceedings and hearings and how to do talking points and how to talk to your legislators and find out who they are. And my beautiful sorority has done much of that training for me. And so at the end of the day, I believe that I am able to speak on these circumstances because I have listened to people across Nebraska as a therapist for over, I don't know, gosh, you guys, when did I start? Since at least a decade, so a little bit over a decade. And I'm relatable. I have had to overcome poverty as a youth. I am somebody who was labeled as a statistic just because of the income that my mom had and being the fourth of 8 children. But I was able to overcome and I was able to rise to the next level. And if we stick together, if we help each other, if we help our neighbor, if we put our research together, guys, we can rise up and conquer this pandemic as well. So let me jump over to the closing of the parks. What about, something popped up. Babe, can you read that? Oh, what about the closing of the parks? Yeah, so I saw that we have the parks that are closed and that the mayor did that. When did she do that? Like Thursday or Friday? Is that what you're talking about, Sean? Yeah. Or did something else happen? Okay. So I think this is just our best way to try to confine it. So, and the research that's coming out here, guys, what do we know? We know that this is something that is airborne for a little bit. What does that mean? That means that even if you're walking outside, if you're working out outside, if you're running outside and you're breathing and you don't have on a mask, and maybe somebody did that walk an hour or run an hour or 2 before you, that you are putting yourself at risk. Now, we know that the masks protect us, but if this is on an environment and it comes on my face or I touch something and now I'm wiping my face, we have 3 mucous membranes where we can accept material into our body. And that's through your eyes, through your nose, and through your mouth. And so those are the areas that we want to make sure that we are protecting when you go to the grocery store. If you have to go, if you don't wear glasses, it might not be a bad idea to put on sunglasses. Please wear a mask. There are many videos out here that are talking about how to make a mask out of handkerchiefs, out of t-shirts. Everybody is being very, very creative. If you don't have that, take a scarf and wrap a scarf around your mouth and your nose, at least until you get out of that facility. Make sure you guys are washing your hands more frequently than normal, because if something has gotten onto your hands and you touch your eye, you touch your face, you touch your nose, you touch your mouth, you can expose yourself to that. And so the biggest thing is, without us doing testing at the volume that people are testing, for instance, in New York City, we don't know, because it can take 2 weeks before people have symptoms. We just don't know who has this and who's a carrier and who's not. And one person who has COVID-19, guys, has the ability to infect 24 people. Think about that. So we are limiting ourselves and we are staying home to protect someone else. And let's see, the closing of the parks. How will you reach out to rural Nebraskans? And so right now I'm reaching out to rural Nebraskans through phone calls and trying to hear what their concerns are. I know that we have so many options. Well, I know technology presents options, but in rural areas, we have to remember what happened with net neutrality. So first of all, you have to have a good network to even be able to expect someone in a rural area to be able to do a live or to jump on a live, right? So what I've been doing is having phone calls. We definitely need to increase our testing in the rural areas, because right now we don't have a good system, guys. We don't. So please reach out to Governor Pete Ricketts and let him know what is the process? What are we going to do? And I know there's a plan forthcoming, but until then, if you are okay and if you do not have any symptoms, please, please, please do your best to limit. Try to go to that grocery store once a week or once every 2 weeks, just so that you don't expose yourself. And people of color need to address where to get food and sanitize a product. And so I know that there are a few groups going on in Facebook Live. So I mean Facebook, on social media, where people are sharing where information, where sanitizer is, where products are, food. And I know that there are some food banks and people releasing. Black Men United, I think that's the group that also has a drive coming up where you can just drive up and pick up some food. So I will share, thank you, Sean, for bringing that up. I will share that information in this live video. And if you guys have any information, please feel free to share that. It's going to take all of us sticking together and pulling together. This is something that we've not seen before, not in this generation. So it's going to take us making sure that we're helping each other. What other questions do you guys have? And so is the person, Miss Doris is the person from rural Nebraskans. If you are in a specific rural town and you would like me to, I'd love to talk with you to hear kind of what's going on and how we can pivot to make sure that we are addressing that with phone calls, because our phone calls might not be moving at a pace where it's getting to everybody. And so please, I'll shoot you a message maybe after this or comment. And yeah, North Omaha, thank you, Craig. We do have a COVID-19 emergency plan, and I can link that in here as well as I know Omaha Public School was doing some lunches at some of the schools, like Benson, I think was one of them. And I have to go back and check and see who the others were. But I'm really thankful that Mr. Mallory has stated that, because we need to have an area to get information. I'm more than happy to share information so that we can make sure everybody is safe. We need that information. So I'll make sure to put all the links on this live. I think everything is like super high up. Any other questions, guys? So if you are in an area of town, or if you're in a rural town and you have noticed that you are not receiving aid or support, or you guys are having a hard time you're not getting information about where to pick up food, can you message me or comment, and I will be sure to do some research on that and see if we can get a team together. We are still dropping yard signs in different places. So I want to thank Lincoln, Nebraska City, Winnebago, Omaha, Bellevue, Papillion, La Vista. Thank you, everyone in those areas that have been reaching out for yard signs. Because of COVID-19, we are putting them directly into your yard for you. That's the safest way for us to not expose you or us, as long as you're okay with that. Some individuals have asked that we lean them, and that's fine. You might want to wait a day or two just to make sure that that's a safe sign for you to put into the ground, because of the possibility of this virus living on cardboard for 6 hours. So just in order to protect you. Any other questions? Okay, guys. Thank you so much for jumping on here with me tonight. I am in the process of just coming on, and so what our campaign plan looks like is we are trying to call all of the voters across the state, and so hopefully we will make sure that we get to everyone. But if you are looking to have a specific conversation with me and we have not gotten to you yet, please note that that is coming. You can send me an email, and you can also give me a call at 402-281-3914. I'll put it in here as well. And I would love to have a conversation and see what's happening where you are in your neighborhood, what you need, and how we can work as a team to move forward and make sure everybody's healthy. Oh, hi, Nikki. Okay, send me your address, and we will get someone to bring you that sign. I think we do rounds again tomorrow. I know today they were in Nebraska City. So thank you guys. Please be well, be good to yourself, give yourself a pass. So I've seen a lot of posts with individuals saying that they're not getting a lot done work-wise and with their productivity. Please remember, we are in the middle of a major crisis. A major crisis. And if you know someone who unfortunately has died, not necessarily from COVID-19, but there are some people who are losing family members and they're not able to go to funerals for them because of this COVID-19 pandemic. So please give yourself a pass. It is normal for you to feel on edge. It is normal for you to not know if you want to go outside, or for you to be trying to change your day and figure out, okay, maybe I want to do this, but now I don't feel like that. That is normal because we're adjusting. We're adjusting to not having clear information. We're adjusting to dealing with a pandemic that is changing, a virus that is changing, and as we learn more information about it. So please be good to yourself. It's okay for us not to have the answers right now, but we will definitely make sure that we stick together, and I will be praying for each and every one of you. And yeah, I will get the addresses to the places with the food and as well as the mask. I'll make that, I'll post that in here as soon as we get done with the live, Mr. Mallory. So thank you guys. I appreciate you. Reach out if you need to, and I'll get in here and start posting some resources. Thank you for coming to Shelton Slay Monday. My phone number is 402-281-3914. Okay. Take care, guys. See you soon. Bye.